This is an acupuncture survival guide for COVID-19. I'm going to be working through points, acupressure points that you can do to relieve cough, to help get the phlegm out of the chest, and help to alleviate any stomach upset that you're having, help to with the pain that you may be experiencing from the virus. Also, I am going to be giving you some great points for cough so that you're able to talk and really to ignite your metabolism so that your body can get this virus out and heal itself. So I'm gonna first go through which points we're gonna be doing, and then I will do a self-guided meditation with you. I would recommend once we get to the meditation part that you put on some soft music, and by doing these exercises, you're going to help your body to your metabolism to ignite. Acupuncture really works with all of the systems in the body, and doing these acupressure points daily is going to help your body to naturally recover, as well as making sure that you're keeping well hydrated with warm fluids to help break out the phlegm. It's almost like a type of pneumonia, this COVID virus that is going on, and so it's really important that you're helping to loosen up the phlegm, and you can do so by doing some of these points and also some dietary recommendations. We are going to be going through several points. The first one I want to show you is called Lung 7. Lung 7 is really great for any type of cough. It's going to help you to talk. It's going to help to get this phlegm out. So the way you find that point is you shake your hand and you bring your pointer finger to the highest point where there's a ridge on the highest point of your wrist. This is Lung 7, LU7. Anytime you do an acupressure point, you want to hold it down to the point where there's tenderness, and you want to do strong, deep breaths. So I'm just first showing you the point. We're going to go through the meditation together. So that's Lung 7. This is really great for helping the cough, helping the phlegm get out of the cough. The next point I'm going to be doing is large intestine 11, which is good for any type of fever that you're experiencing. If you're uncomfortable, remember, fever is a good sign that it's your body helping to cook the virus and try to get it out. But if you're not able to withstand the higher temperatures, you want to make sure you keep hydrating. This point can help reduce your fever. It's called large intestine 11. It's also good for any type of inflammation. So they're saying that this COVID is really a lot of inflammation in the lungs of the alveoli. So this is a really great point for any type of inflammation in the body. The way that you find the point is it's on your elbow, and it's at the end of the crease when you bring your arm together. It's right in there. So when you're rubbing a point, you can use your thumb, you can use your pointer. The thumb is probably stronger. You want to bring it down till the point that you feel tenderness, and you can either hold the point down or you can do small circular motions. So this is large intestine 11, great for any type of inflammation, reducing fever. If you're using it to reduce fever, there's a technique where you flick the point. This will help to reduce the fever, and you can do it on both sides. So that's large intestine 11, reducing fever. So we have cough, we have reducing fever. The next point that you should do is called spleen 3. The spleen in Chinese medicine is about regulating the digestion and helping nutrients. And what happens is if you have too much phlegm and damp in your body, and that is produced by poor diet, it's produced by a virus coming inside, it's going to produce all this phlegm and congestion. This point is really great for alleviating that congestion by breaking it down, by helping the spleen in Chinese medicine and the stomach to help to break down the nutrients and help your body to cope. So it's called spleen 3, and that's located on the big toe. So the way you find it is it's on the inside. The way you find it is at the edge of the toe. It is right here. So it's like at the highest part at the edge of the toe on the side of the foot. So you can hold on there. Again, you want to press it to the point of tenderness. So that's spleen 3. We're going to be going through each point individually. So that's spleen 3, really great for cough, getting the phlegm out, any type of phlegm, really great also for inflammation. So that's spleen 3. The next point is called stomach 40, and this is also really great for any type of damp phlegm, like congestion, any type of buildup of fluids in the body. So that point is on the leg, and the way you find it is you're going to, anything in acupuncture is proportions. So the way you're going to find it is you want to measure the distance between your knee and the bottom of your ankle, and then halfway between that, on the outside of your leg, about an inch over, is stomach 40. So it's the midpoint of your leg and a little bit over from your shin bone. This point is really great for any type of sputum or to help sputum come out. If you're having stomach upset, really great point to help with phlegm or damp in the body. So stomach 40. The next point I want to give you for helping cough, like to regulate the cough, get everything out, is lung 1. And you find that point by bringing your arm together with your chest, and you, a little bit above is where the point would be, like at your shoulder joint, and a little bit over. So you can't do these points wrong. If you're putting it in the wrong, position or just a little bit off, it's not going to harm you. It's just not going to be as effective. So when you're doing the point, don't worry if you're pressing the wrong, a little bit off. You're still gonna have benefit to it. So this point is really great for any type of cough, chest congestion, tightness, asthma, helping so that you can speak. So that's the next one. And then the last one I want to show you is for the chest, and that's between your nipples. You want to find the midpoint on your chest. This is CV17 or REN 17, great for calming anxiety, relieving chest pain. Anytime there's a tender point, that means there's chi stuck in the body, and the idea behind acupressure and acupuncture is to help move the chi. You want to have free-flowing meridians, free-flowing. You want all of the systems in your body to be working together. If there's any point where they're stuck, it causes sickness. That's how we see it in Chinese medicine. So we want to help move along these pathways so that the body can heal itself. So this is CV17. That's the last one. So these points are really great for if you're experiencing symptoms. You have the chest congestion, you have the phlegm damp, you have the tightness, you have difficulty breathing. All these points are really great for that. So I'm gonna now lead you through doing the acupressure points on yourself. You want to take 15 to 20 minutes a day doing this on yourself, and when you're breathing, you want to have at least 5 breaths to every point that you're using. And when you want to do bilateral points, if they're not in the center, you want to do points on both sides. So we'll go through the first one, which is lung 7. So you give yourself a handshake. Take a deep inhale in and out. And in and out. And in. It's really great for helping you to speak. Get the cough out. Do it on the other side. Give yourself a handshake. Deep inhale in and out. Inhale in. Really great point for cough, asthma, congestion, difficulty speaking. Next point, reduce is great for reducing the fever, helping with inflammation, helping any diarrhea or constipation. This is large intestine 11. If you have a fever, you're going to be doing this. If you're just looking to help with the inflammation, you can press. Long, deep breaths. Help your body to self-regulate. And the other side, this is really great for constipation, helping reduce inflammation in the lungs, inflammation anywhere. Finding large intestine 11 with the crease on the end. If you're having difficulty breathing, you can just hold the point and breathe as you can. The next point is spleen 3. We find that on our foot. And you find that in the inside of the foot, on the big toe, right at the bone. Let your body relax. Pay attention to your shoulders. Allow your body to fall and relax. This is really great for any type of congestion, that's phlegm stuck in the lungs. Helps to break it up. You can do the other side. Inside of your foot, big toe. Deep inhale in. The next point is stomach 40, and you find that by finding the proportions of your knee to your ankle and finding the center of it and finding the shin bone and then going a little bit out to the right. This is stomach 40, great for any type of phlegm, damp, regulates diarrhea or constipation. regulates breaking the body down of the virus, anything that's in congestion. Take a deep inhale in and out. And in and out. And in and out. And in and out. Now do the other side. You're going to find the bottom of the knee and your ankle and find the center point. A little bit out to the right. Deep inhale in and out. Deep inhale in and out. And inhale in and out. And inhale in and out. Inhale in and out. The next point is CV17 or REN17. This helps to break up chest congestion. You want to find, for the upper respiratory infection, find your nipple, and in the center of the nipple in your chest, compress until it's tender. Deep inhale in and out. 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 So these points are for the treatment and prevention of the coronavirus, to help the body to help self-regulate and self-heal. You can do this treatment at least once a day, every day. You can even do it twice a day. Take 15 to 20 minutes to do this on yourself. While you're pressing the points, make sure you're taking deep breaths. This will allow the oxygen. If you're not able to take the deep breaths, you just breathe the best you can, and rubbing the point is going to help your body to self-regulate and help all the systems work together in calming your mind, calming your body, and helping to alleviate yourself, boost your energy as well, and help with any type of pain that's going on in your body. So be well, everybody. If you would like any more information, feel free to reach out to me, Liz, at handsonacupuncture.com. You can go on my website, www.handsonacupuncture. I will be offering telemedicine to my patients and to anyone who is interested to help us through this hard time and give you tools in helping to help yourself through this crisis. Be well, stay strong. We're going to get through this all together. Continue to do your practices and you will be safe.